This is A Drugless Life. Podcast by Dr. Paul Beckham and All Seasons Full Body Chiropractic Center. Using alternative, complementary, and integrative medicine to help you live a drugless life. We get you back to doing what moves you.
Boom, we are live.
All right.
We were just having fun talking about,
In our deep voices.
because that's a deep subject.
Yes. So speaking of deep subjects, we are going to talk about something today that I don't know if it's really a deep subject, but it's something that we've noticed is a really common symptom in a lot of people in the office here, and that is numbness and tingling in the arms and legs. And we did a blog post back in, I think, December of 2017 about this, and we've noticed there are so many people that are seeing that post coming in because they said we are having this problem. And before we started recording, which we said we should be recording this whole thing, I asked Dr. Paul, I said, so is numbness and tingling in the arms and legs simply because of a misalignment of the spine? And he said, no. There are a lot of other reasons. And that we do screening in our office to determine that. So I'm going to turn that over to you, Paul. Yeah. I want you to share with me kind of what you shared prior to us recording on what are some of the reasons that people might be experiencing numbness and tingling in their arms and legs.
Well, I guess like we were discussing before we got on the show here is that, in most chiropractic offices, what are we trying to clear up first is any kind of nerve root irritation or nerve problems that are coming from the spine. So, in most chiropractic offices, that's going to be the first primary area that they're going to go to try and find out if that's going to help it. And some might just blindly keep treating it that way and hope that the numbness and tingling will disappear, and that might fix it. That might not. I mean, it might take care of that 80%, of the people out there, but there's that 20% left over that just don't respond to just spinal manipulation. But yes, that's why we have, all of our screening tests that we put everybody through when they first initially come into the office here, is to determine exactly what's causing the problem here. Is it coming from the nerves? Is it coming from the muscles? Is it coming from the bones and joints? Is it, coming from another area that, hey, maybe we need to even refer out to get, either further diagnostic tests or a consultation to see if that's causing the problem, whether it be a vascular problem or, somebody has some other kind of endocrine disease, diabetes, thyroid issues, adrenal issues that could be causing some of the numbness and tingling in the arms and legs or hands and feet. So
what might be some of the symptoms that you notice that would be, hey, you are one of the 20% that we can't treat and we need to refer it out? What is something that in the testing you would notice?
Well, even just symptom-wise, when people come in, typically one of the big things that would just kind of set it off would be, hey, do you have stocking and glove numbness and tingling? That's kind of a classical, hey, that's really probably more of a hormonal thing there. Some of which could possibly be helped with, some nutritional types of things. Can be helped with the K laser we have in the office here, but that probably is going to be something where, hey, if they haven't been diagnosed with some kind of hormonal issue, we're going to want to make sure they get sent, that person gets sent out to get some lab work done to determine, hey, are they really having, just something that maybe is spine or nerve related, or is it literally a hormonal issue? Is it the adrenal glands? Is it the thyroid? Is it, possibly a diabetic type of a neuropathy that's going on?
So when you say stocking and glove numbness and tingling, basically just in the fingers, is that what you mean by that?
Stocking and gloves. So think of where you might have stockings on and where you might have gloves on.
Okay.
So that's where people would have, the numbness and tingling occurring. If it's not occurring anywhere else and it's just in those areas where those, stockings or gloves would cover, then those are areas that, hey, we're going to need to probably get some lab work done on just to either rule in or rule out the possibility of those possible hormones causing the problem. So
if I'm understanding it right, if somebody is noticing that there is radiation from into the arms and the legs, there's a bigger chance that it's maybe musculoskeletal then?
Musculoskeletal, or it could be a nerve root or not nerve root, a nerve entrapment, along where the nerve travels there. If it's a nerve root, if going back to that, it could be, again, from the spine. And that's where, you can possibly get that cleared up with just regular chiropractic care. But again, yes, if you're noticing issues that maybe start, in the shoulder and then extend down the arm, hey, then we need to just definitely get the shoulder evaluated a little bit further there. That's where we'll get into some of the functional movement screens. We'll get into some of the extremity muscle testing to help pinpoint down exactly where the problem's at. And people will definitely know for themselves from those tests that, hey, it's not moving like it should. Or when we do the muscle tests, I can't do that. It's definitely what they perceive as weaker on one side compared to the other side. And again, usually it's not that it's weak, it's more that those are inhibited because there's some kind of tissue that's irritated, or it's your body's just natural response to kind of guard that so that it shuts it off. It's like the muscle is inhibited because the tissue is irritated.
So, nerve root problem. If you find that somebody has a nerve root problem, is that something that you treat in the office here, or do you refer that out?
That's what we treat all the time in the office here. I mean, there's tons of people that come in that have issues with the nerves being irritated right where they're exiting out of the spine, and like could be multiple different reasons why they'd have that. Could be disc herniations, could be degeneration that's occurring where they have some bony spurs that are protruding into where the nerve roots are exiting out of the spinal cord or spinal column itself into the vertebra. There could be obviously other issues there. People can have just swelling of the tissues in that area there. I mean, you can get into vascular type things that could be causing problems where the nerve roots are getting irritated and it's just literally compressing the nerve root where it's exiting out. A lot of times that's just trying to get that all calmed down. A lot of times, most people, if you go into the medical office, they're going to give you, non-steroidal anti-inflammatories. They're going to give you muscle relaxers. They're going to give you maybe some cortisone or prednisone to take to help deal with the swelling and all that's going on.
Or surgery.
Or, jump to a surgery. I mean, hopefully that doesn't happen in all cases there. I mean, really they're finding that should be the last resort, really, because, if you're having significant weakness in your hand and it is not improving with treatment, or it's just unrelenting pain, something like that might be necessary, yes. But that's less than 1% of the cases that are going to really end up, having to have a surgery. So,
what are the benefits of people coming to you when they first notice problems with numbness and tingling in their extremities versus going to a medical doctor?
Well, like we just kind of mentioned, they're going to give you that cocktail of drugs there just to kind of help cover up the symptoms. I mean, that's really all they're doing. They're not fixing anything. It's like, having the little red warning light in your car go off and you're putting a black piece of electrical tape over it to not see the red warning light anymore. The problem's still there. It didn't disappear. It's still there. They haven't found where the problem's at, but here's this cocktail of drugs to kind of deal with all those issues: muscle tension, muscle spasms, swelling and inflammation, pain. And, what we're going to try and do here is find out what's causing the problem. So hopefully we can get down to, the tissue that's causing the problem and get it resolved for a person. And then we have different therapies and modalities that can, help relieve all that. So there's a very minute percentage of people here that we really can't help. And if we can't, we'll make sure that they get to the place where they need to go to get it resolved. So
what is it that what is the process when somebody comes, if they do have numbness and tingling, and you find, you're finding that we can help them in the office? What do you do to help them?
Typically people are going to come in, they're going to have kind of we would call it our core 3 screening here, where they're going to come in, they're going to have a movement assessment done just to see how things are moving or not moving. Is it, normal, functioning normally, or is it not functioning normally? Are they having pain with it, or are they not having pain with it? And there's, I think we just updated here now. I want to say there's like 28 different screening things that we take them through in that movement screening there to find out what is or isn't working right. And next after that is a posture screening, where literally we take some posture pictures, and it's very detailed, gives you very detailed numbers. Sometimes it's a little bit too much information for patients to look at there, so we try and bring it down a little bit so they can kind of understand it there. And you can literally see how your posture is, and it gives you kind of a score on where it's at, and we'll kind of give you an idea of where it should be at. It's pretty straightforward again, so you can kind of see it right on a piece of paper in a picture right in front of you there. The other test that we do with everybody is a surface EMG, which measures the stress along the spine of all the nerves and muscles. I guess the best way I kind of describe it is kind of like electronic palpation. What I'm feeling where the muscles are tight, it's hard to kind of describe that. I can go through and say they're mild, moderate, or severely tight, but this gives us really some numerical values, so you can kind of see exactly how tight those muscles are, how stressed basically the muscles and nerves are along the spine, and we can then progressively recheck that as a person goes through care. Normally we'll see it kind of even out, and then slowly kind of come back to their normal. It might not be normal as far as how the test goes, but we just need, everybody's got a different stress level and different activities that they're performing at home and at work and all that. We just never really know where that's at, but we just want to see it even out and stabilize over time. So those are the 3 core things. Those will help point out then whether we need to do other things after that, maybe like some x-rays, we have some digital x-rays, so we can kind of look at things there. Do we need to maybe do some other tests? Once we have those initial core 3 things with everybody there, then, if they decide that, hey, it is something that they want to get treated, that's where we would get into possibly if we have to take the digital x-rays, some of the extremity muscle testing screening being done. We also include a digitized foot scan to kind of look at your kinetic chain, which some people come in, hey, I have headaches. Why are you doing that? Well, we just want to rule it out and make sure that's not an issue here that's causing some problems with your body's whole structural system here. Because if that's off and that's causing it and we don't address it, and you keep having headaches over and over again, we don't want to be fairly reliable Bob's Chiropractic Clinic with a disappearing tailgate guarantee here. We want to get the problem fixed for you so that you can get on with your life and be fairly bulletproof and be able to do what you want to do whenever you want to do it.
Mm-hmm. So basically, that first screening that people come in for, other than the x-rays, you'd be able to determine if it's something we can help in the office or if it's something we need to refer out basically by just that screening.
By just that screening there, we're going to know if a person has a problem or not. And they should even know it themselves. I mean, it's going to be like, yeah, I can't move that way, or yes, it's painful. It's, it's like, well, do you have a problem with your neck? No. Well, can you back your vehicle out of the garage? Well, no, I can't look over my right shoulder because my neck's stiff. I mean, there's some very common things that just people don't think about on a daily basis. Those are some of the checks that would be done during that movement screening there. It's like, okay, this is what I'm seeing here. And I try and correlate it with the symptoms that the patients are coming in with. I mean, if they come in with a lower back issue with numbness and tingling going into the right leg or something like that, okay, let's look at what does that functional movement screen look like here? Is that what it's kind of pointing out or not? Is there some other things going on that, hey, looks like we need to look at this area a little bit more here too. That might be actually worse, and that might be causing a compensation, which is then causing some of the numbness and tingling because of how your body's compensating there.
So I notice I struggle with numbness and tingling in my right arm quite often, and it's usually coming from my shoulder blade area and goes all the way down into my fingers. And I notice it when I'm doing a lot of mouse work on the computer, and I think there's a lot of people, because I've talked to people that have this problem. What is going on there? Can you kind of explain structurally what's going on for these people?
Mouse neuritis, no.
It's bad. It's a bad deal.
Yeah, it's fairly common. I guess I see it in the vast majority of people that have office work that'll come in that, especially if they have numbness and tingling in the arm, especially their right arm, if they're running a mouse with their arm. I usually try and get them to switch over to a more ergonomic mouse, maybe like a thumb trackball one or something like that, just to make sure that they're not ongoing, causing that problem to get worse there. But usually the biggest problem is that their shoulder blade and their collarbone aren't very stable, because this doesn't happen like the first day you go in and start using a mouse on a computer or something like that. It's usually something years down the road, and it's that you started to use some muscles in a way that are not, I don't want to say appropriate, but I mean, they're trying to compensate and do what they need to do for the actions that you're doing, running a mouse. You're trying to move it around and click on things on the computer there. And since it's not very heavy, I guess in the case of looking at a mouse, one of the muscles that gets aggravated there is your subscapularis muscle. You can develop trigger points in it, and that's where some people can get numbness and tingling showing up in their extremities there. And that muscle, they even call it the hidden culprit, because a lot of people will never, ever, ever find it, because it's actually on the front side of your shoulder blade. And I get a few people coming in here, yes, I got to work in your armpit here, because we need to get that muscle calmed down, because as soon as I touch it, it's almost like it's on fire on some people. And I'll push on it, and it gives them the numbness and tingling in the areas of their arm where they've been experiencing it. So here, actually, the problem is in that muscle, which we need to get the trigger point out of there. So we'll do some soft tissue work on that. A lot of times, the different therapies, maybe even the laser work on the muscle there to try and get it calm down again, get it to function normal again, get them doing some rehab exercises to kind of balance it back out. And again, have them switch over to kind of an ergonomic mouse so that they're not always moving that shoulder and stressing it again, because their shoulder is not stable. It's slowly over time gotten deconditioned or used in a posture way where it's not meant to be used. So
well, and I notice when you adjust me, you adjust my shoulder and my arm as well, which was a new experience for me, which has helped. Any exercises that people who are going through this should be, I know there's exercises that we should be getting up, I hear, like every 15 minutes from our computer, which I can be the first to say that I do not do that. I do it when I think of it, but I don't do it well enough. But I know there's exercises that can help us combat some of those problems. Do you know what some of those would be that you could share with them?
As far as for the mouse issue?
Yeah.
The mouse issue there, you're going to want to do some exercises where you're kind of trying to squeeze your shoulder blades together. Usually I have people supinate their hands, meaning they'll maybe even just sit in their regular desk chair. They're going to turn their hands so their palms are facing up towards the ceiling and their thumbs are going to be pointing out, and they can literally try and pull their arms out and try and push their thumbs back, and you'll feel that pinch in between your shoulder blades there. That's going to start to strengthen basically kind of your lat muscles, your trap muscles and all that. That'll help pull those shoulder blades back. And if you do it more in an isometric sense, it's going to start to help add some stability to the shoulder blades there. So over time, that can help. It might seem like it aggravates it if you don't get the problem resolved first. So if you're still having that issue with that subscapularis muscle being weak or inhibited, a lot of people, it's very hypertrophied because it's being overused over a long period of time. And if you don't get it treated, it's going to still kind of hang in there. But you might be able to get it calmed down with some of the exercises. So you can always try the exercises first. And if it's not getting any better, make sure you get it checked out to see if, hey, that subscap is just kind of still all lit up on you there. So
one of the other things that you mentioned to me prior to us recording is that you have had farmers that have come in with toxicity levels in their system that are causing numbness and tingling. Did I hear that correctly?
That can be one of the issues here, where people will have, peripheral neuropathy, just chemical exposure. So like in the area here, farmers with exposure to some of the chemicals that they're going to put on their fields, some of the herbicides, pesticides, and all that can cause, that numbness and tingling. It can kind of kill off or cause problems with the circulation, especially in the hands and the feet. Again, that stocking and glove kind of issue there. So maybe if they don't have hormonal issues going on, hey, maybe have they been exposed to some chemicals in the past? They might need to do something to kind of detox that stuff out of their system, but it might already be too late for some of that there. And you can always try and see if you can get that stuff out of your system, get tested for it, and see if you can get it resolved. Sometimes that's where, again, the laser is very, very helpful in getting back some of that circulation for them. And if that's the case, that might not necessarily be all that's needed. Usually they're going to get it treated for probably about a dozen treatments, because it's probably a chronic thing there, and they're going to probably need some ongoing treatment with it, because they probably are on some medications, gabapentin and different things of that nature that are going to try and help deal with some of the neuropathy issues. But I've had people that have been on that, and that slowly becomes less and less effective over time too. So,
yeah, I just thought it was interesting because, with our whole body concept, that you're asking those questions in the beginning to really find out, what is the root cause of the problem, whether it be musculoskeletal, whether it be a circulation issue with neuropathy or toxicity levels, which is happening so much in our environment lately.
Even some of the other therapies, like with the farmers there too. I mean, we have our PEMF therapy, which, that helps out with the microcirculation in a person's body there. That can help out a lot in improving the blood flow there. So if they start to do something to kind of help detox, they're probably going to have to get some specific agents, prescription type things, where they have to go in to be able to pull out some of those chemicals out of their system. Occasionally you can get some things to help detoxify the liver, which are just over-the-counter types of things. But some of those people are going to need something, some extra help to clear out some of those chemicals. But
right. Well, and I like that you brought up peripheral neuropathy because you deal a lot with helping people with that issue as well. And so we will post a link to that in the comment section too, just some of the things that we offer for people struggling specifically with peripheral neuropathy. Anything you wanted to add on that piece?
I mean, some other things that can come up with people that have, peripheral neuropathy is that if they don't have really good sensation, especially in their feet, they can end up having some balance issues. So they're going to notice that they just can't walk really well or can't stand really well. They feel kind of wobbly. A lot of those people are going to end up with a cane or a walker or something like that. So some of these patients that are having those kind of symptoms, it might be that they have a peripheral neuropathy type problem and not really necessarily, just a balance issue there too. So,
Which we also have special testing that we can really find out if it's to the degree of neuropathy.
Yep.
Yeah.
Just had a patient the other day, she couldn't even feel like the thickest one that we have. So I was like, that's, definitely not a good sign there. So, and everybody responds differently to treatment. So, typically we'll see a response within the first week or two.
So, the screening you're talking about, if somebody is experiencing numbness and tingling and they're like, oh my gosh, I need to get this looked at. I've been putting it off. Because I'm guessing for most of you out there who are experiencing this, you didn't just experience it and you're getting seen right away. I'm guessing it's come on and it's been there for a while if you're
and you've probably been multiple places to try and get it treated at too.
True. So if they're interested in coming and getting the screening, anything else they need to know about the screening, I'll post contact information with this. But our number is 701-356-0016 if you live in the Fargo-Moorhead or surrounding areas. Anything else they need to know about the screening?
Yeah, I mean, if they want to come and do the screening, I mean, we do charge $30 for the screening, but we always donate that money to the local cause. I mean, we have different causes. We try and change them up about every quarter or so. So whatever that happens to be, we'll be donating your money towards that. But we just use the screening just to kind of help people out. So if they do have a problem, you can kind of get a chance to get it screened, have a consult with the doctor there, and they'll let you know, if you have something that could be treated and what you need to do from there. And you always get to decide what you want to do.
So yeah, if you're listening to this and you're wanting to get the screening, when you call our office, again, I'll give the number 701-356-0016. When you call our number, just mention that you listen to this podcast, you're experiencing numbness and tingling, and you're interested in the $30 screening, just to make sure that you're getting the right screening so we can determine the root cause of your problem. So thanks for listening in.
Yep, and I hope it was informative for you. Have a great day.
Thanks for listening to A Drugless Life. For further information or to set up an appointment, visit our website at drpaulbeckham.com or give us a call at 701-356-0016.